Yeah.
Perfect. Thanks so much, Kim, and thanks for having me in your class. So it would be really helpful to start off. I'm a really informal guy, so I know we're being recorded. Always freaks me out. But it's nice to conduct this class more like a conversation. So essentially, although I have a whole bunch of PowerPoint slides, we don't have to stick to the Manen scripts. And I'm also hoping that you could feel comfortable at any point just jumping in by saying, you know, what about this, or I don't quite get that, or how have you thought of this? Okay? It makes the class much more fun to not only attend, but also to teach as well. So to start off, maybe we can go around the room and say a few things about ourselves. I'll start off, because I'm talking already. So my name is Michael Manen. I'm the director of the Doster Health Ethics Center, and that's an interdisciplinary health ethics center on campus, which includes members not only from medicine, but also nursing, rehab medicine, non-health faculties, clinical ethics, and so forth. So we view health ethics very much as an interdisciplinary activity. The other part of my life is I work in newborn intensive care, which, if you're at all interested in medicine, most wonderful place to work in the world. No offense, pathology lines. Oh gosh, working with babies for a living and their families, I swear you get to see people at their absolute best. Right? When families gather together around a child and try and figure out what's the best to do for them. So somewhere in that intersection between newborn intensive care and health ethics is where I do most of my work. And I've come to this class now because Kim has been kind enough to invite me to join for the last, 3-4 years-ish?
Yep.
So. And so I get to see him twice a year, which is always nice. So maybe I can pass it down and we'll just say a bit of ourselves.
Absolutely. Hi, I'm Sarjana. I'm in my 3rd year of my Bachelor of Science in Psychology. I don't have much of a background in law or medicine, but I've been learning a lot this semester.
Perfect. Nice to meet you.
Hey everyone, my name is Daniel. I'm in my last year of psychology. I'll be graduating in June, hopefully. And yeah, I don't also have too much of a degree that's focused around medicine, but I have had opportunities to kind of experience what it really is like, and so I'm glad that I've gotten the chance to be a part of this class to kind of really understand how a lot of my pre-standing knowledge and some of my experiences kind of applies to the future events.
Hi, my name is Lean, and I'm a 4th year as well, doing biology and psychology. And what was the second part of the...
What brings you to the class today?
Oh, okay. I have always had an interest in science fiction, medicine, and ethics, so I'm actually taking a moral psychology class this semester, and I'm just really interested to see how that kind of interconnects with this class.
My name is Ella. I'm a 4th year biology student, and I'm really interested and have always been interested in pursuing a career in medicine, whether that's doctor or research, not too sure yet, as well as pharmacology. I'm currently conducting my own research in how drugs affect development, and so I'm really interested to see kind of new technology and where we're heading in terms of medicine.
Hello everyone, my name's Hannah. I'm one of the many TAs for the course. I'm in my 4th year of an elementary education degree, so medicine wasn't really something that my degree necessarily took, I guess, a look at, but I was always very interested in neonatology actually, and before coming to university I was very interested in that field, but I just took a different path, just working with kids but just not in that medical sense. So yeah, I think they both kind of have their similarities, but yeah, just took the other path.
I hear you both, my parents were teachers.
Oh yeah.
And they were teaching during the decline years. You remember that?
Yeah.
And so they told me I was not allowed to go into education. But the next best thing was medicine, pediatrics, because we share the similar ethics.
Yeah, absolutely.
So hi everyone, my name is Isla and I'm an education graduate. So I spend most of my week teaching, but I try to take one day out of the week to come here and support Dr. Souza's class and help because I'm also a TA, I forgot to mention. So I like to be part of the group and be, help like with the engagement of the course and everything like that. So I try to come once a week. But yeah, that's kind of about me.
Hello everyone, my name is Hish. I'm doing my master's in modeling, data, and predictions, like under math and stats. I did my undergrad in comp sci, so like I'm like always interested in like technology, AI, and I'm also a futurist. Like I believe in like looking ahead and seeing where we're going or where we want to be. So that brought me to this course.
It's nice to meet you all. I know Dr. Celeste needs no introduction. So how did we get to giving you homework from this class? Alright, so this is not my fault. Dr. Celeste, when we were emailing back and forth, told me what an articulate and amazing group of students he has this semester.
Yeah.
And I would be absolutely remiss not to take advantage of that opportunity in some way or form. I'm very loosely paraphrasing our email exchange. But to be honest, if you're really interested in health ethics isn't something you just sit in the lecture theater and you're so-called taught. I'm not trying to get you to memorize any concepts, any long words, any moral theory. What I'm instead hoping that this class or seminar or conversation today offers is for you to start thinking about technologies in some different ways. Both technologies in the sense of, yeah, what they're designed to do, but also a lot of their unintended or untoward effects that touch on how we relate to one another. Because once we start talking about technologies as affecting our relationships with one another, we begin dealing with ethical questions. How is this other person in front of me being presented to me? How am I responsible for them? How do I see them? And that very quickly leads into normative concerns of what makes a good technology. Not just one that functions well, but actually one that we somehow think makes our society better, our interactions between teachers and students better, a child's life meaningful, and so forth. So I'll put this on at the beginning. I just did. I'll put it on at the very end of the presentation as well, and then I'll email it to you along with my slides at the end of today as well. What I'm hoping is each of you can choose one contemporary or future technology. It could be something as simple as a scalpel, right, to AI-generated meeting transcriptions of patient-doctor encounters, right, to something else that we're only on the fringes of being aware of or you can imagine. Right? So pick any technology you want. And then I'd like you to prepare a 6-minute presentation. Please don't take longer than 6 minutes. And I'd like you to try and approach that technology creatively in the sense of addressing these questions. This isn't a marked assignment, right? It's not going to inform your grade at the class. It won't inform what I think of you or Dr. Celeste thinks about you. But it's rather something that I'm hoping will support us to actually learn ethics, right, by having conversations with one another. If the TAs would love to do this as well, fabulous, right? The more the merrier. But my thought of choosing 6 minutes is, that kind of leaves 6 minutes and then maybe 4 or 5 minutes of discussion, and that will kind of use up the majority of the class. I think half an hour is a reasonable amount of time to spend on this. Certainly one could spend many more hours on it, but I also recognize many of you have other competing demands in your life, and that's why I've suggested turn the timer on 30 minutes, say this is how much time I'm going to spend with this, and if you want to spend more, of course, that's more. Does that sound okay? So ethics is a lot about reflection, so we're going to begin with some reflective questions. How do you understand the meaning of ethics? What do you see as significant ethical questions for the future of medicine? What makes a question an ethical one? How do the ethics of technology relate to the ethics of medicine, or nursing, or other branches of healthcare? Particularly if we consider health broadly, also education. Do we anticipate the qualities that exemplify what makes an ethical nurse, physician, social worker, or other healthcare provider to change over time? What is the role of ethics in clinical practice? And of course, what is the role of ethics and technology in our practice? So I'm going to try and introduce you to this by way of my world. I'm not poetic, but I'll read some short anecdotes. A premature baby lays in an isolette. A sheet cast over the housing mutes ambient light just as the plastic structure itself attenuates sound. Only traces of the outside world seem to be allowed in. Within, old towels support the baby's body in a position of flexion. His arms, trunk, and legs shift in subtle shudders before settling in stillness. The eyes gaze, yet seem to lack a point of fixation. What is life like for this child? What experiences of sight, touch, and smell exist for him? In the adjacent spot, a newborn is sedated and paralyzed as we struggle to maintain oxygenation. The baby lays splayed with only the chest movement, vibrating in response to the airflow of the oscillation machine. As we're talking, the baby's heart rate rises. With muscles relaxed, she cannot move without moment paralyzed. Does she experience isolation or loneliness, pain or discomfort? What words are appropriate to describe her existence? Tucked in the end of the row, a baby seems almost too well to be in intensive care. A nurse brings a soother towards his mouth. He puckers his lower lip and rolls his tongue. Stroking the soother against the corner of his mouth, the nurse pauses for a brief moment. His eyes are fixed firmly on her. Taking the soothe in, he gives it a few short sucks before letting it fall off to the side. How does a baby experience a world of others? How does he experience a world of things? I work just across the hallway in the Stalwart Children's Hospital, third floor of the hospital. And for the most part, you could say these are very much everyday observations from our unit, where we're taking care of babies with a manifold of different medical technologies. We're dealing with issues like prematurity, so we take care of babies born as early as 22, 23 weeks. They weigh less than sometimes 500 grams. They're so immature, their eyelids are still fused together. And if you touch their skin, it's almost like jelly, sticky. We have other babies we take care of where there was some kind of a complication around the time of birth. Maybe the placenta separated from the uterine wall, an abruption. Maybe there was an issue with how the placenta itself was functioning, or an issue with the cord. And the baby was so-called asphyxiated and has suffered some kind of injury to their body and their brain. Some injuries babies recover from, some they're forever left to change. And then we also have some babies who are born looking so well. Right? And sometimes we forget they're even so-called sick. But maybe they have complex congenital heart disease or surgical issues, many of which may be correctable, but others that can only be palliated in the sense of their life ahead is going to be full of more and more surgeries. There's many ways of orienting the ethics in the NICU. We can orient ethics as far as, is it a right or is it a wrong decision to offer a particular baby surgery or to not offer a particular baby intervention? Is it right or wrong to withdraw medical interventions? But fundamental, prior to any kind of normative question in the NICU, is the fact that the care that we're offering is not for me it's not about me as a healthcare provider. It's not about my life values, beliefs, religion, and so forth. We're orienting to someone who's other than ourselves, a baby. And what's so fascinating about newborn intensive care, pediatrics, early education, is that we're constantly trying to understand what this world is like for this little baby. Recognizing that, you know what, we've all been babies, we've all been there. But the way that we experience the world now, our vocabulary for it, isn't necessarily fitting. Because we're no longer children in that sense. This is ethics. Ethics expresses some kind of orientation to whom or what is other to ourselves. And this is a slide just showing, I mean, first and foremost, yeah, I work in newborn intensive care, but I'm a pediatrician. And that's where I come out of the specialty. And this is through and through all of pediatrics. Right? Even when we're talking about adolescents or individuals who are approaching adulthood. An ethical orientation is always first and foremost trying to orient towards gaining insight or understanding into someone else's life, recognizing we don't want to reduce their life to our own subjectivity. In other words, you'll never be able to, as a teacher, 100% be able to understand the meaningfulness of a first day of school for a kid going into kindergarten. But you still have to have insight into understanding into what that's like as you're supporting them on that first day as their parents are walking away. And sometimes that's even understanding the parents' experiences probably more than the kids. So, what is ethics? If you've never used this resource, it's fabulous for writing papers, right? Oxford English Dictionary, their, what do you call it? Historical thesaurus. It's just fabulous how you can trace the meanings of words across different contexts. And everyone here has access to it through the University of Alberta Library if you go through that. So we can say that ethics is regarded as a branch of philosophy, but philosophy itself we can recognize as a cultural phenomenon. Etymologically, the term ethics originates from ethos, meaning the moral atmosphere of a people or community. This gives ethics this sense of something that actually isn't stable over time. Right? So we recognize that what might be or have been okay in the past isn't necessarily okay in the present. Ethics doesn't have a solid foundation to it. But if people were to try and pin me down and say, Michael, can you tell me what ethics is about? You're supposed to be the chair of ethics, or called ethics here at the University of Alberta. I would say ethics is other regarding. So it doesn't start with me, it rather starts with that encounter with someone else. If it was only about me, it wouldn't be an ethical decision. So an example I often give to students, I have two kids, an 11-year-old and a 16-year-old. They love ice cream to death. I don't know why, they just love it. Me and Paul is their favorite. And it's not uncommon after dinner, they go into the freezer and they grab that container. Right? And if there's lots of ice cream, they wouldn't think twice about it. But if they were to open it and realize there's only one serving left, then it becomes an ethical decision. Do I take it all? Do I share it with my brother? Because suddenly their decision making is affecting someone other than them. Ethics is beyond logic. So what do I mean by that? We can talk about ethical knowledge. So if you were to say, you know what, 1 + 1 is 2. By definition, that's true within like mathematics systems. Right? It's a priori true. There's other knowledge that we can verify. You might say, gosh, it's rather cold outside. It feels about 8 degrees. And you know what? We can walk outside all together, and we can measure the temperature, and feel it, and we can say, a posteriori, after the fact, you were right? You were correct on that assertion. But when we start talking about something as being good or bad, it doesn't have that same foundation to it. So it's dealing with a different kind of knowledge. So typically ethics, when I say it's beyond logic, that doesn't mean that you can't use reason in ethics. In fact, a lot of approaches to ethics rely heavily on reasoning your way through a scenario. But I would suggest there's always something more that you're dealing with. Right? So when we talk about like, what principles should I use to guide my moral actions? At the root of it is some kind of a leap where you're actually saying these are the principles. We can say ethics is concerned with normative questions. So when you're asking questions about good or bad, right or wrong, there's something there that speaks to something. And we can say that ethics is concerned with value. So it's very hard when you start talking about ethical issues that are really passionate to people. Sometimes you need a Kleenex box. Sometimes you'll need a table in between you, right? Sometimes these are very sensitive discussions. Is this driving making sense? And I'm curious how your moral philosophy class approaches all of this. I'm sure it's the exact same philosophers. So, how do we understand intersections between ethics and technology? Because this isn't a moral philosophy course. Right? It's not a course on ethics 101. You're here because you're interested in technology, the future of medicine, or technology and other applications as well. So what I would begin by saying is that the most mundane and everyday technologies that we encounter in life, we take for granted. Technologies are part of what it means to be human, right? If we were to look around the room right now and ask, what about our interaction here is not in some way shaped by technologies? We're adorned by technologies. We're wearing our technologies, whether we're talking about our clothing, our glasses, our heart rate monitors, or whatever fancy watches some of you are wearing. Some of us also have ingested technologies. We use technologies to get here. Technologies are shaping the way we're talking in the room. And this is very weird. It's like some kind of spacecraft. For some reason, like half the room is in one corner. I don't quite get that, but whatever. But nonetheless, the fact that I'm sitting here and I'm looking towards you, the technology shapes our interactions. And when we talk about technologies being encountered pre-reflectively, it's the point that we take them for granted. And it's often those most everyday technologies that nonetheless are deeply meaningful for our interactions. Now, there are whole branches of philosophy of technology that have taken this as a theme. In a class like this, I like to point to the word Abdon-Aïd. And the reason for it is he's very accessible. Right? He's an American scholar, well regarded within media ecology. And he has a number of contemporary students who continue to draw upon his more early work to really explore technologies beyond their instrumental value. So when we talk about a technology having more than an instrumental value, PowerPoint, its instrumental value is it's allowing me to point certain things out, right, to complement my words. But there's also other ways that it's shaping our interactions, and even my way of talking. I find it very hard with a PowerPoint presentation not to so-called break the flow of the presentation, right? Because you've kind of forced in advance to decide what you're going to say. You become less spontaneous. So there's these other unintended effects. Don-Aïd gives a very nice framework where he talks about how should we think about a technology mediating my experience of the world. So he draws upon phenomenological philosophy, to basically say that my consciousness of the world is always mediated by something. And he uses words like embodiment relation, hermeneutic relation, alterity relation, and background relation. So he would say some technologies we embody, right? So the technology becomes part of me and it changes the way the world is disclosed. Right? So the classic example here would be a hearing aid, a cane. Right? When I'm holding a cane, I feel the world through the tip of the cane. Right? It changes my being in the world. I'm embodying it and it's becoming part of me. Some technologies we embody so deeply and so routinely, we don't feel normal without them. Right? If you don't believe me, for those of you in the room who are also visually impaired, try and start your day without grabbing your glasses. You just don't feel like yourself. There are other technologies that we have a hermeneutic relation with. Right? So they change the way the world is disclosed. So when I look at a thermometer, even before going outside, it presents the world as interpreted to me. There are ones that are so-called in an alterity relation. So we confront them as another. Almost to the point that we feel a sense of responsibility to them. I would feel so guilty if I threw out our couch. It's been there for me for years. For all those nights I've been post-call and exhausted. I almost have an alterity relation with it. Hey Siri, set a timer for 30 minutes, right? We're designing some of our technologies so we develop a relationship with them and we approach them like another. And then there are others that are in the background. How often do we think about the air conditioning in a room, unless that room's particularly cold or particularly hot? How often do we think about the technology of these nice sound-absorbing panels that prevent the room from being echoey? Right? Yet nonetheless, they shape the way that we're present around them. So for your assignments, this is one way that you could begin to open up whatever technology you choose. And what I'm trying to do in this lecture is to give you a bit of a vocabulary, some possible ways of entering into and opening up other ways of thinking about that technology. There are some technologies that we look at and we say, you know what, that's solely like, that's a technology that we embody, like a stethoscope. But on the other hand, there's also hermeneutic aspects to it. When I put a stethoscope on, usually I'm not thinking too much of a baby anymore. I'm really focusing on trying to listen to the first and second heart sound. Are there any clicks? Are there any murmurs? Is there a gallop? Right? And in a way, the child becomes a heart to be heard. Compared to an X-ray, right? We don't really talk about embodying an X-ray, but certainly we have a hermeneutic relation with it, right? It changes the way a child is seen. Compared to an incubator. Right? So we use these for any kid pretty much born less than 1,500 grams. Right? To keep them warm, to keep their skin so-called, or the environment humidified so they don't lose too much fluid. That's its instrumental value. But how do you give a baby a hug when they're in an incubator? How do you pick them up to hold them? How do you talk to them? So you can see that it's formative of my relation with it. Unintended side effects. If you've just had a baby and you're in a wheelchair, right? How does this technology actually support different people in different ways of being in the world to be with their babies? Hoping that you're starting to see these are all ethical technologies. You might not think about them every day because they're so routine, at least in my world they're routine. The stethoscope, the X-ray, the incubator. But all of them touch on this relation between parent or healthcare provider and baby. They're all constituted of this relationship of self and other. And that for me is that fundamental way into technologies, the ethics of technologies. How is it that our technology structures, mediates, changes, affects my relation to whom is other than me? Recognizing that other is not just this child, but it's also all others. So we could imagine for this mom in the NICU whose baby is, going to be stuck there for potentially some months, right, who needs this technology to survive. How does it make her present to her other children at home when the technology inadvertently keeps one of them there? So, post-phenomenology is a nice way of getting in, right? A nice way of starting to think about technologies and their mediational roles. There's other approaches. In past years we've talked about people like Marshall McLuhan as a way of thinking about the effects of technology. Another way to move ethics and technologies from that experience orientation to a more normative way is to start to look at different kinds of moral theories. So what do we mean by a moral theory? So a moral theory is basically how do we locate what is so-called considered good or bad? How do we make sense of that? And we actually use moral theory all the time in medicine. We don't necessarily refer to contractualist perspectives or deontology. We don't use the words, but intuitively we use it when we're making sense of situations. And we can approach any technology by also asking deontologic, consequential, or character-based perspectives. So I'm hoping you can also use this to enter into talking about your technology. So what is a deontologic perspective? So deontology, sometimes referred to as obligation, duty, or rule-based ethics, views something as right or wrong based on how it conforms to some kind of rule, principle, or articulation. So if we in this class were to agree, you know what, something that is very, very important is that people shouldn't interrupt one another. That's like a foundational principle. We should respect everyone's voice. Then we would judge people's actions as being right or wrong, whether they conform to that rule. And there are lots of systems of rules, right? Everything from the Decalogue to the Ten Commandments, the sayings, and so forth. Many of them have common features between them, but some of them are also ranked or ordered in a particular way in a particular culture. So one of the challenges that deontology gets into very quickly is how do you decide what are the right rules to follow? And this is where Immanuel Kant comes into the scene when he refers to the categorical imperative, which essentially says, act only according to the maxim whereby you can at the same time will that it should become universal law. In other words, the rules that we should follow are the rules that I would expect other people to follow as well. If I would ask that other people don't cheat me or not dishonest to me, then I should also not cheat them and not be dishonest to them as well. The rules that have value are the ones that we would ask others to follow. In health ethics, we often refer to rules such as something doing good or beneficence, something avoiding harm, non-maleficence, respecting the independence or agency or autonomy of a patient. And those that are not just equitable for a patient, but also for a group of patients, fairness or justice. So those are the so-called 4 cardinal principles. And there's a lot of professional standards that exist that actually articulate these are the ethics that you should follow for your practice. And in medicine, by and large, our conduct as healthcare providers is regulated by professions. You can't just go out there and say anything. Well, that's not true. Did you read that CBC News article today that's happening? Colleges are no longer going to be able to sanction their members if they want to say right? Things change. There's a difference between law and ethics. Okay? But the point is not to memorize any of these principles. You don't have to memorize the rules, but to recognize one way of thinking about what is good is by saying, well, what rules or principles should we follow in this situation? So when it comes to particular technologies, particularly future technologies, in the context of health, are these 4 principles enough? Are there other principles that should be adhered towards? For example, when we talk about AI, should an algorithm somehow be transparent? Is that a principle that AI needs to follow? How about for other technologies? Now, I don't have all the answers here, right? Because this is actually really an exciting area for health ethics. As we come up with new technologies, what principles should they so-called conform to? And there are some thoughtful readings in the literature which propose different principles for different technologies. But I would suggest this is still an evolution. And the recognition is because every technology is somewhat different, it might not be helpful to use the same set of rules for all of them. Right? The same sort of rules for a stethoscope might be very different than rules for an incubator. Like maybe we need to think about rules around incubator design from an equity perspective. Right? That people should not be disadvantaged in holding their child or coming in contact with their child as a consequence of its material design. Maybe that should be a principle. But maybe that's less important for designing a stethoscope. So, what rules ought to be conformed to in technology design? Another way of locating morality or locating where something is good or bad is called a consequentialist perspective. So consequentialism takes the consequences of an act as the ultimate judgment as far as whether something is right or wrong. In other words, the end justifies the means. If something has some kind of net benefit that we all agree upon is the benefit that we should achieve, then it's a good thing. And you might say, gosh, this sounds absolutely horrible. Think about all the bad things in this world that have been done under the justification of the end justifies the means. But medicine is very consequentialistic. Those principles of beneficence and non-maleficence are often interpreted as just two sides of the coin of consequentialism. A medical intervention, the benefit should outweigh the risk. Gosh, we saw this in the COVID pandemic, right? Save the most lives possible. That's as consequential as you get. Right? Now, there's different forms of consequentialism depending on what is that end you're trying to maximize. Are you trying to maximize lives saved? Are you trying to maximize the most human happiness for the most people? Are we thinking only according to our species? Or are we thinking to something beyond us? Animals, the environment? What other are we so-called concerned with? And who is so-called so other that they become a distant other? So when you're thinking about your technologies for next week, what ends ought to be achieved with them? And therefore, how do you see value? Character-based perspectives to ethics, or person-based approaches to ethics, such as virtue ethics. Here the focus is shifted from some abstract principle, or the ends of an action, to qualities of an individual themselves. So what does that mean? That means that, instead of asking what end should we be aiming to achieve, or what principle should we follow, what kind of virtues are exemplified by someone in a situation? And often this is, in some ways this relates to principles. On another way, it's more complicated than that because it's tied up with the acting. So what would a good doctor do in this situation? it's somehow shifting that away from what principles they follow to rather what exemplifies someone in that profession. You know, my example of the first day of school. What does a good teacher do on the first day of school? Who do they talk to? Who do they focus their attention on? How do they balance the fact that it's the first day of school potentially for what? 20, 30, 35 kids? Class sizes are crazy these days. So what does this mean for technologies? Well, if we take seriously the idea that we are technological beings, right, that to be human is to inherently embody technologies. What makes us human is our capacity to embody technologies, for us to use them and forget about them, but they become part of ourselves. Well, if a technology makes us more communicative, more empathetic, more understanding, you know, if it enhances our memory, right? Does that also speak to it being a good technology? So, you know, talk about something like AI scribes, right? You know, if it allows me to be more present in an encounter, does that speak to its moral values, right? Because it somehow supports certain virtues. There's also communitarian perspectives. Communitarian derives from the Old French to make common, share, open, public. And there's lots of different ways of articulating communitarian perspectives, and I feel guilty by putting all three of these on the same page because they're all different in their own way. We can talk about narrative ethics. The idea behind narrative ethics is we make sense of our world through stories. I'm not sure if you've ever had that experience before where you're trying to explain something to someone and it's just not working, so you say, let me give you an example. And you walk them through a story of something happening. And those people who are narrativists recognize that narratives are an inherent way of human sense making. And when you talk about a narrative ethics, it's somehow recognizing that sometimes what makes a good story, and I'm not talking about an entertaining story, okay? I just watched, what was it, Bad Monkey on Netflix? That was not a good show, right? Or was it on Apple TV? It wasn't a great show, right? It was fun, but it wasn't a great show. But when we talk about narrative ethics, we're talking about those stories that we can somehow share. Right? They somehow held together. People made the best they could of that particular situation. It wasn't just their characteristics, their virtues, it wasn't the ends, how it all ended, but recognizing that ethical situations are often very complicated. So when we talk about technologies, what stories do they afford? How do they shape the way that we live our life? In a different way, we have relational ethics, which situates that kind of sense of goodness within the relations we have with one another. And then you have ethics of care that draws on various feminist theories. And I can't really get into all of that. I can't do justice to any of these things. They're all deserving of like a talk in themselves. But I'm trying to, at this point, start to give you guys a sense of that vocabulary. There are also contractual perspectives to ethics. So the idea here is that morality actually doesn't exist. Right? Like there are no absolute so-called moral rules or obligations. But morality is something that we negotiate on a day-to-day basis through our agreements that we form with one another. If you were to ask whether a surgeon did a good job performing their operation, probably what they might answer is, I did as we talked about in our conversation before the operation, that consent conversation, right? Recognizing that sometimes surgeries don't go well. But by doing a good job, it is somehow living up to that contract of care. Right? So we negotiate contracts of care every day when we get that consent from our patients. So do technologies form contracts? Do they form agreements? You know, there are philosophers who write about technology and memory, and say that memory, language, speech, whether you're talking about writing or something more advanced, is all technological. So the agreements that we have, the way we so-called, develop a historical discourse, is mediated by technologies. Then there's Kazaiatry approaches to philosophy. Kazaiatry kind of takes this view that if we want to understand ethics, right and wrong, maybe we need to understand how we make sense of previous situations. So if this was so-called right in the past, why was it right in the past? And how is that past situation different from our current situation? Sometimes I'll hear it in my world, we operated on a baby with this rare genetic condition before, and we all agreed that was the right thing to do. How are things different this time? Why is there hesitation in our group to offer that same medical intervention for this kid compared to the other? Now, I already alluded to in the past that, the past is not descriptive of the future. Right? Ethics is a social phenomenon, a socio-cultural phenomenon, right? So we also need to acknowledge that in the past, people of particular genders were disvalued, right? Not acknowledged. Certain people were privileged over others. Right? Some of this reflects, social constructions of race, of gender, and so forth. But some of it also reflects technologies that made such determinations possible. So ultimately, when we start talking about these different heuristics, and they're truly heuristics, because you can arrive at different conclusions about the so-called goodness of a technology or situation by viewing it from a different perspective. That's what I mean by heuristic, a way of exploring or questioning something. What we're interested in is somehow building morality. Right? We're interested in technologies that somehow make our lives better. And here's the example of Langdon Winner's Bridge, right? These bridges apparently line the American kind of highways. They were apparently built at a low height, and they restricted public transportation from going underneath the bridges, right? So a bus wouldn't be able to go under them. And indirectly what that meant is that people who relied on public transport, who were generally people of lower socioeconomic standing, privilege, we won't go into all the details, were kept out of certain places. So people would say, damn, that's a bad bridge. The point is here that technologies are not neutral things. So morality can be so-called built into them. But of course, it's very context specific, because well, where is that bridge put? So this is where you have things like actor network theory, the work of Bruner and Latour. Humans and technologies are enmeshed, bound up together in networks of socio-technical collectives. We can't view technologies as somehow different from humans, but rather we are all part of these networks together as actors. Actors not in the sense of people who play pretend, but rather actors as agents. And depending on our role in these networks, different actions may be delegated to us. Right? And his classic example was the sleeping policeman. Right?
Well, question. Like 2 slides before you mentioned technologies are not neutral. Like shouldn't the goal in a way be for them to be neutral?
That's a really good question, and it's interesting, right? So there's I would say most people would suggest in kind of media ecology studies that an older view was that technologies were somehow neutral, that they were just instrumental, in that sense that, you know what, guns don't kill people, people kill people. They just happen to pick up a gun. But on the other hand, if you take it seriously, then what happens when you pick up something like a gun, that it changes how you relate to the world? Can you really talk about it as being truly neutral. If you don't believe me, give a gun to a 9-year-old and see what happens, how they start to play. Because technologies, we don't simply pick them up and use them as neutral objects. We become inbound or enmeshed with them. Like they change our being in the world. Now you could say some technologies are more neutral than others. Like, oh gosh, like, you know, that Starbucks coffee cup, that's extremely neutral, right? It's not gonna hurt anyone. But then on the other hand, you can start saying, well, you know, what kind of plastics is that made from? Is that reusable? Like, how is that affecting others in the world? As you proudly keep up your plastic reusable water bottle, that's probably leaching plastics into the world right now too. No, I'm just joking. But I mean, so, you know, on the one hand, I think we can aspire to neutral technologies. But I would say for a class like this, what I'm hoping for is people take a reflective stance to realize that more often than not, technologies have an effect on us. And some people will design technologies particularly with a moral aim in mind. Right? So forgetting the example, my colleague Kathy Adams, who's, I don't know if she still is teaching in education, she taught like a pedagogy and technology course. If it's still offered, Catherine Adams, she's phenomenal.
Catherine Adams?
She's in secondary ed.
Elementary.
Elementary. So she used to teach about these couches that were designed, and they were really neat couches. And what was so neat about them is that they were essentially built in layers. And when you sat on them at first, it was just an everyday couch. But over time, that top layer would kind of wear, and then you'd see another layer underneath. And then over time, that layer would wear, and you'd see another layer underneath. And really, it was designed from that perspective of how can we support people to become attached to their things? Because it's very easy to just buy another couch, right? To live in a so-called disposable world. And maybe a good couch isn't one that just, you know, supports my lower lumbar spine and my back, you know, or I can fall asleep on it. But maybe a good couch is one that I keep around. One that I'm invested in, that I'll be more likely to say, you know what, yeah, it's an old couch, but I think we get the foam replaced in it rather than just throw it out and buy a new one. Right? So that's an idea of, you know, you're somehow designing with this moral sense. And people, I think, who, you know, partake in that kind of design, they're asking that question of, well, from a principle perspective, a good couch is one that is not just durable, but one that, you know, is kept, is not thrown away, that doesn't impact our environment. Or maybe more broadly, anything that we design should be things that we don't throw away. Maybe the next, you know, good Apple laptop is going to be one that, you know what, you bring it in and you keep your old case and you just put in a new chip, rather than constantly just get rid of the old and get a new. I mean, so when we talk about sustainability in design, right, so is sustainability a principle for all technologies? Does sustainability make sense when it comes to designing a good gun? One that you'll never throw away? Maybe not the right principle there, right? But maybe one that has some kind of a child lock or something else would be a good thing. I don't think much about gun design, but I'm trying to give like some different examples, right? And then that becomes like more interesting when we start talking about AI. So what makes a good AI scribe? Okay? What makes a good AI interface for medical records? What makes a good website for helping people identify what ails them? And so forth. So on the one hand, yeah, neutrality, but I would say that things have overall shifted from one of viewing technologies as neutral to one that says that, you know what, technologies, they affect how we live in the world, or technology affects how we live in the world. And now the shift has moved, you know, at least for the last, 20, 50 years, to one that says, you know what, technologies are very different, right? Like this lanyard that was given to me by a patient, it's a very different technology than my iPhone, which is very different from my bag, right? So we need to look at every technology in a unique manner when we talk about its ethics. That makes sense. So back to Bruno Latour, when we talk about objects and so-called design and delegating certain things into them, you know, his famous example was the sleeping policeman. Right? And so when we look at a speed bump, we shouldn't actually look at it just as a bump in the road, right? But rather we're delegating the actions of some human, right, to the actual thing, to hopefully have a moral effect, which, you know, in Edmonton isn't just direct the undercarriage of your car, it's to help you to slow down, right? So you don't run over a pedestrian. So how do we put this all together? So I talked to you a little bit about, well, what is ethics, right? And these are points I'd just like to end with by saying that ethics exists as a discipline precisely because the rightness and wrongness of our actions cannot simply be reduced to reasoning or calculation. So we are reasoning when we're saying, well, how does this technology affect us? We are reasoning when we talk about, you know, what are the unintended effects, or what principles should technologies abide by in the design. But on the other hand, at some point, whatever ground you're dealing with involves some kind of value-based judgment of what is really important in life. Right? Now, most of us tend to agree on certain things, right? Most of us, I think, in this room would tend to agree that, you know what, we should do things that don't hurt children, right? That's probably something that most of us agree. On the other hand, we might disagree on other things. So some of us might be, you know, thank you, Siri. You know what, we should never harm puppies, right? Because they're puppies. But it's okay to eat them. Or little pigs. I don't know, whatever. Like, so we might have different values, right? Because at some point when we talk about a common ground in ethics, there are different values in different societies. And Alberta is a very interesting place to live when it comes to values. Now, some people talk about common morality or universal ground, but often these so-called common grounds are somewhat abstract. For example, you know, most people would agree, I think, in North American circles that you should respect the autonomy for a patient as a principle. But what does respecting autonomy mean when you're talking about a newborn who's never expressed what their values are, right? Babies don't choose who they're born to. Does that mean that children are deserving of different care as a consequence of who their parents are or what their values are? How much latitude do you give that autonomy? So when you take something abstract like autonomy and you try and specify it to a particular situation, that's where it often gets really interesting. So often what we do in ethics, clinical practice, design, is we try and find the best response we can for the situation. And if we can't find the absolute best response, it's a reasonable response, a compromise, something that will work to go forward. Thankfully, not every single patient and physician, patient nurse, or other kind of healthcare encounter is fraught by you know, weighty moral issues where you have to sit and reflect for like half an hour. Should I or should I not reduce their dislocated arm, right? Like it's just, their arm's dislocated, they're in pain, what can I do? But on the other hand, how should I approach that individual? How should I care or comfort them? That is actually a deeply ethical question. It's just we often don't reflect on it anymore. So, coming back to the assignment, I've talked for just over an hour. How do you guys feel about this? What questions do you have? What would you like to talk about?
Well, one of my questions was, when you're kind of using all different scopes to like address ethics and the different perspectives and everything, is there really like a favorable ethical outcome, because I feel like when you're trying to choose the ethically like correct, like make the ethically correct decision, and you establish that there is like a framework where something's correct and something's like wrong, I feel like there will always be people who like interpret that decision as wrong, even if it like appeases like a lot of people. You know what I mean?
Yeah. So it's a good question, and there's one of the struggles is that people often want to know what is ethical. And ethics is also one of those really funny words that a lot of people like to use. Right? So it's not uncommon that you'll hear a political leader say, we have to do this because it's ethical. Right? We need to respect the rights of people not to wear a mask because that's the ethical thing to do. Right? So it's used as a qualifier for a judgment to basically say that this resonates with our values or my values or societal values. But strictly speaking, it's very hard to actually say something is ethical and something else is not ethical. I try and avoid that kind of a language. I think it's the only time I would say something that's being really unethical if it's giving complete disregard to who it's affecting, right? If it's not accounting for different people's life experiences. Then you start to wonder, is that really ethical? Is it responding to someone other than me? Because if it's just about me, you're really not dealing with an ethics question. You're just dealing with your own values. Now, are there certain heuristics that are more appropriate or useful in certain situations? For sure. So when we're trying to do things like policy development work, and you can think of policy development as actually technology, right? A policy is something that is built, crafted, designed, applied to a situation. We often use principles, or some kind of principles. So we start from that position of saying, let's have a starting point for agreement of, what should underlie this decision-making framework. What's a good example? Policy making around organ transplantation. Who should get organs when there's lots of people on the waiting list and there's only a few organs available? Who should get vaccines when there's only so many vaccines available, but lots of people? So when you're dealing with scarce resources, principalism often works, or is helpful. One of the big criticisms of the Alberta government's response to their immunization campaign is they never really made it explicit what was their so-called moral framework for making some of their decisions. I think the closest thing that we heard from them were consequentialism statements, in that sense of, save the most lives possible, right? Or Alberta lives. I'm trying to remember, do you remember what the slogan was? But, so people would say, well, what principles are you using to decide, like, why is it that some, 65-year-old retired person who, is well-to-do, lives in their own home independently, is getting a vaccine before someone who lives in a, multi-generational home, who doesn't have the ability to socially isolate and so forth. Right? So who made that decision, right? And what principles were used to guide it? So yeah, sometimes that's very helpful. On the other hand, sometimes like narrative approaches are really helpful in dealing with issues at the bedside. And there's other approaches to health ethics I didn't mention here, like phenomenological ethics, which can also be very helpful in certain settings as well. Other questions?
It says in the future practice of medicine. So the technology does it have to be like specific to medicine?
Honestly, I'm just happy to do this. So for me, I would love it if everyone chose something different. But if half of the class chose the same thing, that would also make it really interesting, because we'd see how differently different people approach it. The only reason I chose medicine is just the theme of the class. But really, if someone wanted to choose something for education, that would be great as well. Particularly if we're actually speaking seriously about health. Health has very little to do with what happens in the hospital setting. It's much more what goes on in the hospital. Other thoughts, comments, questions? So next Tuesday, what we'll do is we'll use some very random way, like a random number generator or taking the numbers out of the hat or just volunteerism, whatever you guys do. And we'll just take turns going through each presentation. If at all you get stuck, here's my email, and I'll include it with the email up to you guys here. And then please feel free, you can email me anytime in the next few days or over the weekend, and I'll do what I can. But I'm hoping that what people can appreciate is this is really just a support discussion. It's not to put anyone on the spot. So homework is not really the right word, nor is assignment. It's more just about how can we actually have us dialoguing and talking around things rather than so-called being taught about ethics. Perfect. All right. See you guys on Tuesday.
Thank you so
Great,
much.
thank you.